Hi everyone, my name is Carole Drexel. I am a medical director at PlatformQ, and I am pleased to present the data from this poster that we recently submitted and got accepted for presentation at AAD 2021. Moving the needle with virtual education, impact of chronic idiopathic urticaria education on patients and healthcare provider. This education was done in collaboration with AFA, and Sana's Urticarial was part of our faculty panel. The background for this education, we had identified several gaps in the management of chronic idiopathic urticaria, and related to its diagnosis, because no causes can be really identified, and also lag among clinicians in stepping up therapy and provide relief to patients. And similarly, among patients, lack of awareness of what their therapeutic options were, specifically when it comes to any over-the-counter therapies, for example. I would like to say that this education was posted on our PlatformQ channel, Immunology Live and MedLive, and as I said earlier, done in collaboration with AFA. On the bottom left of this slide, you can find our learning objectives for each audience, the HCP first, and then the patient and caregiver on the right. The methodology for our outcome was characterized with a pre-test before the education, followed by an immediate post-test and a follow-up survey at several weeks after the education. We also had polling questions, and we evaluated participation during the live and the on-demand education, and we also had a CME evaluation for the clinician. The methodology, the same methodology, was used for both the patient caregiver and for the clinician education. The second slide is going to show you some engagement material on the left and some pre and post and follow-up results on the right. Nice HCP and patient caregiver engagement with 866 HCP attending the education, both live and on demand, and over 11K patient and caregiver attending the education. And as I said, very nice engagement as demonstrated by the number of download and respondent to polling questions. On the right are selected polling, selected pre and post result to activity questions, with showing a nice post-activity increase for knowledge, for competence regarding first-line therapies for the patients, and nice retention, and similar profile when it comes to knowing when to refer a patient for targeted agent. The next slide is going to focus on our patient and caregiver data. On the left, nice increase in their confidence from in managing the condition, and nice increase in confidence in communication with their clinician. Looking at the pre, post, and follow-up bar graph on the right of the slide, we also have nice immediate knowledge increase among those patients for first-line treatment and when patients should go see a specialist. But we can see the decline during the follow-up indicate that those patients definitely need some reinforcement on those topics. And future education should continue to address this critical area for patients to keep engaged with their clinician. Slide 4 are some reported attitudinal and behavioral impact of the education. These were self-reported and collected 2 months post-education about both HCP and patient. So just as an example, 91% of the HCP reported a positive patient-on-patient outcome. And for example, one cited that they would make quicker resolution of symptoms and better quality of life as a result of being better able to manage their patient. Looking at the patient and caregiver, 80% reported improved communication. And as an example, this patient reporting being able to fully communicate what is improving and what is not improving their quality of life and also their skin. Moving on to the discussion and the conclusion, this definitely demonstrates the positive impact of tethered aligned education for patient and clinician, this education being focused on chronic idiopathic urticaria, its evaluation, guideline treatment, and targeted treatment for the condition, and also nicely empowered patient in their shared decision-making process. And below this conclusion, you can see a list of educational messages for future education on both the management of chronic idiopathic urticaria or the disease itself for both clinician and below for patient. Thank you for your attention.